Good afternoon and welcome to the CIBHS Peer Leadership Institute webinar series. Today's webinar is entitled Peer Providers in Integrated Care Settings. I am Kristen Dempsey, Senior Associate at CIBHS and one of your trainers for the Peer Leadership Institute project, and I'm the moderator for today's session. I'm pleased to be joined by the rest of our team who will now introduce themselves.
Good morning, this is Lucinda De Rossi.
And this is Debbie Brasher with Inspired at Work. And Kazra.
And this is Kelly Vitz, Program Coordinator at CIBHS.
And that's Kimberly Mayer, who is our Associate Director at CIBHS, and Linda Smith, our Training Consultant, who are not here today, but who are also part of our project team. So today I'd like to introduce our presenters, who actually just introduced themselves, Deborah Brasher and Lucinda De Rossi. So welcome. Great. They're from the California Association of Social Rehab Agencies, also known as CASRA, and Inspired at Work. And we are so appreciative to have them here today to do this webinar. So thank you very much. And I will hand it over to Deborah and Lucinda.
Thank you so much, Kristen. We weren't quite sure if we were supposed to introduce ourselves there or not, so we jumped in. We're not part of the project team, although we're very honored that CIBHS has asked us to present during the webinars. And so Deborah and I have extensive experience working with peer providers for at least 25 years, and we also, as part of CASRA, have written a toolkit on integrating peer providers into integrated care settings. So Debbie and I are very passionate about this topic. It is so important for us to spread the message around why is integrated care important, especially for people with mental health diagnoses, and what is the role the very, very important role that peer providers can play in integrated settings. Next slide, please. So really what we're looking at is that peer providers in integrated settings can really increase the health outcomes of people with mental health diagnoses, in addition to healthcare issues or substance abuse issues. We're looking at improving health outcomes, improving the longevity of people's lives, as well as the quality of life near the end of life. So all of those things are things that peer providers are going to be really critical in making sure happen for the population of folks that we work with. So in this webinar, we're going to talk about, well, what is integrated care? What's the evidence around the effectiveness of peer support? What are some national models that are being used and have some research? What are common job titles and duties that you might look at in your own career? And what are the goals of those services in integrated care, as well as the issue of how do you, as a peer provider, fit into a culture, not just a mental health or a behavioral health culture, but then a primary care culture as well. Next, please. So, and this is just a Wordle that I like to do. My children taught me how to do it, and in this one of the words that stands out for me is the word synergy. And really, this is integrated care is about creating a synergy in the system so that people can access primary care services, substance abuse services, and mental health services in an integrated way. And integration actually is a very broad term that can mean co-location of services, but it also can mean just coordination of providers between the services. So it exists on a wide or a long spectrum, but its goal is to make sure that people have access to all the services they need for a healthy life. Next. So one of the reasons that we're so passionate about this is that there's been a lot of research done, and probably most of you know that that research has shown that people with a serious mental illness, their life expectancy is 20 to 25 years lower. And not just that, but that the last years of their life are actually, they experience a lower quality of life. And that's, I think, a really heartbreaking thing for those of us who are aging, where we're seeing people in their 50s and 60s having a very poor quality of life until the end of their life. And so peer providers have a very important role to play there. We also know that people with a diagnosis of serious mental illness have increased incidences of all the major health problems in the United States. And those include, on the next slide, cardiovascular diseases, heart disease, diabetes, cancer, and metabolic syndrome. Metabolic syndrome is a syndrome that is a collection of risk factors that can lead to stroke, heart attack, and those factors include obesity, high blood pressure, high blood sugar, and high cholesterol. And it's no coincidence that many of the folks that we work with end up having metabolic syndrome because they have particular risk factors that we're going to talk about a little bit later. Next slide. So there are both structural or institutional as well as individual level risk factors that make people with a mental health challenge more at risk than the general population. This includes, and these is researched data that is a very seminal journal article by Parks and Svensson, where they really looked at hundreds and hundreds and hundreds of people. And one of the things they noticed was that provider stigma played a very big role in whether you got appropriate treatment. So, for example, 2 people go to the doctor complaining of chest pain. One has a diagnosis of a mental health issue and one does not. What they found is that given the very same symptoms, the individual without a diagnosis was more likely to receive an angioplasty, which is a way to unclog arteries in the heart, whereas the person with a mental health diagnosis was not, which indicates that, of course, when you go to a primary care physician and you have a mental health diagnosis, everything seems to be colored by that diagnosis. So that's a very important area where we need to focus some attention. Other factors obviously are poverty, separated systems of care where I have to go to my doctor in one location and see my psychiatrist in another. Polypharmacy, which is the use of more than one drug in the same category. For example, people who are on 2 antipsychotics or 2 antidepressants or more. And just the use of psychotropic meds itself increases our risk factor for poorer health outcomes. Next, please. So at the individual level, one of the things that we see is that there are some modifiable risk factors that affect, obviously, our long-term health outcomes, and those include smoking. One of the things that we know about smoking is that at this point, 23% of the population smokes. However, 75% of people with a serious mental illness diagnosis smoke. And obviously we know how dangerous smoking is to our health. So other risk factors, drug and alcohol use, poor nutrition, lack of physical activity, med side effects, and positive and negative symptoms. So in this category, what we're looking at is that positive symptoms may cause people to be fearful of going to the doctor, whereas a negative symptom may mean that a person is so tired and unmotivated and withdrawn that they simply can't get to the doctor. These modifiable risk factors at the individual level are of particular importance and make the peer role particularly meaningful, because what you're asking people to do is to look at their lifestyle and change their lifestyle. And people who have similar backgrounds, similar experiences, are going to be taken more seriously and have more credibility than those that have a very different life path. Next slide, please. This is just a visual representation of some of the things that lead to health disparities that we've been talking about. It's just a quick way of looking at some of those barriers to access. Poverty, stigma, race and ethnicity, and lack of coordinated care. And all of those issues lead to health disparities, meaning that folks with diagnoses get different and less care. Next slide, please. So in response to looking at this data and in response to looking at overall health of the population, there's a major federal initiative called the Triple Aim. And the Triple Aim is to increase care integration so that we can reduce overall healthcare costs, improve the population health so that everyone gets healthier, and also to improve the patient experience, because it's really recognized that patient experience determines whether people are going to follow up with their health care needs, whether they're going to learn self-management skills. So there's a real focus on patient-centered care as well. And this is one of the roles that peer providers can be especially effective in. Next slide, please. So when we're looking at integrated care, we're also looking at holistic care. And what this means is that we can't really just look at a person's physical health challenges or mental health challenges. We need to look at the whole person. And Larry Fricks, who is a very important and well-known national consumer leader in integrated care, and he currently works at the Substance Abuse Mental Health Services Agency, and we're going to talk about him again when we talk about WHAM, but he really believes that when you look at people holistically and you really value their mind-body resiliency, that there's a level of excitement that people can experience along with better outcomes, so that understanding the whole person helps that person to become activated and to create a healthier lifestyle for themselves. Next slide, please. So what are holistic services? They really look at the whole person and each dimension of the person as being of equal importance, that my occupational life is just as important as my physical health care life and my spiritual life. It also looks at ensuring that the practitioner, health practitioners, are looking at all dimensions of people's life and they're assessing it and prioritizing areas of concern. It also means that we really need to offer a wide range of different options for people to help them make lifestyle changes and healthy choices. It also means that we need to provide the education, skills, and support that help people build self-management skills. Next slide, please. So this is a visual created by Peggy Swarbrick, which really is a very nice visual to look at all the various domains in our life, including our emotional life, our financial life, social, spiritual, occupational, environmental, cognitive or intellectual, and our physical wellness. And this is really to help people remember that there's just so many dimensions to a person. What we'd like you to do now is to just take a moment to think about your own life from this perspective, looking at what are the dimensions of your life and what ones do you prioritize. And we'll put up a poll in just a moment. but the question is, we were only able to put up 5 of the options because it's just a drawback of the webinar system. But we would be interested to know people's perspective on which dimension of wellness would you prioritize. And we've had the environmental, spiritual, social, physical, or emotional. And the poll is open now if you'd go ahead and vote.
If you have multiple people at your group site, you can click multiple answers or type those into the question box.
So see, it looks like there's 22 people in attendance in Solano, so what we should have lots of answers.
Okay, we're going to give you guys just a few more minutes to type in your answers. I think we have some coming in through the chat box.
Okay, so I don't, Kelly, do you want to go ahead and, okay, great. So were we able to get some responses? A 100% on everything. Okay. So I'm assuming that means, I'm not sure what that means, or it may mean that we prioritize them all equally. It also may mean that because there's so many people in one room that people, you know, one person chose environmental, another chose spiritual, but that's okay. It's a lovely visual to look at, and it really was just a way for us to help you think about what are the different domains.
I did get some other answers here.
Okay.
So one other person said the physical and social were their top ones, and social and environmental were kind of their top, another top persons.
Wonderful. And so it shows you how people, that just your physical health care or your mental health care is not the totality of who you are, where you live, what neighborhood you're in, whether you have more than one roommate, whether you have a spiritual belief or not. All of those things impact our overall wellness. And that's really the goal of holistic care, is to help people to create wellness in their life. Thank you, Kelly. We can go on to the next slide. So what is the effectiveness of peer support? You know, we know that most of you may have already heard about the research studies on peer support. We just wanted to really briefly reiterate those. We know that in drop-in centers that people experience an increased quality of life. They have an enhanced social support and problem solving, which is really important in learning to self-manage healthcare issues. Self-help groups tend to decrease symptoms while increasing coping skills and increasing life satisfaction. Obviously, life satisfaction has a lot to do with stress, So the less stressed we are, we know that the less stress will impact our physical health care. Peer specialists have been proven successful in engaging people. This is another really important peer role, is to help people who may not have gone to the doctor in 20 years figure out how to go get a physical. Next slide, please. We also know that for people with co-occurring disorders of substance use, we know that peer support results in fewer hospitalizations, improved social functioning, reduced substance use, and improved quality of life overall. It also shows that it reduces the overall need and use for mental health services over time, so that peer support leads to people needing to access mental health services less and less. Next slide, please. So now I want to talk about the three major research programs that are out there for helping people manage their healthcare needs. And the reason that this is so exciting is that all three of these pilot projects have research to support the use of peers in healthcare management and in whole health care. And those are the Bridge, WHAM, and HARP. And I'm going to go through the Bridge real quickly, and then Deb will finish WHAM and HARP. So the next slide, please. So the Bridge is really a sort of a wraparound way of providing healthcare engagement and self-management. It uses the model of the behavioral model for health service use for vulnerable populations. And that model really suggests that there are some people at greater risk for health disparities and therefore need specialized services in order to help them access those services. Next slide. The Bridge uses a model, coach, and fade approach. And so just want to describe this really quickly. So Carl is the peer counselor, or the peer whole health coach, and he's helping Jose, who has not accessed health care or primary care in a number of years, and when he does need care, he goes to the emergency room. So Carl, in their first interventions, would model the behavior, meaning he would sit with Jose and make a phone call to the doctor in order to make an appointment while Jose is there watching. Then, after Jose's watched a few times, Jose would then be asked to make the call himself, and the coach, or Carl, would be sitting right there with him, encouraging him, helping him if he runs up across a barrier, like a receptionist who may not know that Jose hasn't had a doctor's appointment in 20 years. So the coach is right there with you, helping you engage in the health behavior. And then after that, after the coach observes that Jose has been successful in doing that health-promoting behavior, he would then fade away so that so that Jose would now be engaging in that health behavior on his own. And what they would do at that point is determine whether he had another goal that he needed to work on, and they would move on to that next goal using the same approach. Next slide, please. So the peer role at the Bridge, which is actually located in Los Angeles through Pacific Clinics, they do engagement, they bridge between the three systems of care, which is why it's called the Bridge. They help people they help people to connect to primary care. They teach self-management skills, and we're going to talk about that a little bit later, what that is. And they also use an in vivo approach, which basically means real-life situations. They go with people to the doctor. They go with people to the pharmacy. They help people with their health care plans. Next slide, please. So what do we know about the bridge so far? It's got great outcomes. It's shown that after 6 months, people report that they have decreased health problems from 9.3 to 5.9 problems. Interesting result that they didn't really expect was that people had a reduced overall bodily pain. They also reduced their use of psychiatric medications, whereas the group that did not receive health navigation increased the number of medications. They also showed a dramatic increase in using primary care physicians versus using the emergency room. Next slide, please. And we're going to, Debbie is going to continue on the PowerPoint presentation with WHAM.
Hi, everybody. So the next national program we want to highlight is the Whole Health Action Management Program, or fondly known as WHAM. This is one that Larry Fricks, who we mentioned before, has been instrumental in creating. It's also something, if you wanted to take a look at their participant manual, it's something you can access online by Googling it. And it's a manual that's designed to help people self-manage some of these chronic physical health conditions that, that the people we're working with are dealing with. The WHAM program has 8 weeks of what's called group peer support, and there's a program. I'll go over the different elements that are covered in that 8 weeks. But in addition to the group peer support, there's also individual peer support sessions. And those whole health coaches are helping people learn skills and providing the support they need to get engaged and manage their own health conditions. So one of the key things is it's designed to educate people on the 10 whole health and resiliency factors. And then another thing that's really focused on is the relaxation response. Being able to reduce your stress by understanding and using the relaxation response is key to better health outcomes for people. So next slide. So here you can see the overall content of WHAM. The stress management, having a good support network, healthy eating, optimism. I found that one a very interesting section on how you help people build more optimism in their lives. There's a section, of course, on physical activity. Also an interesting chapter on cognitive skills to avoid negative thinking. So what do we do about our self-talk, and how do we help people learn to have more positive and self-affirming health self-talk? Sleep, of course, vital to people's health and well-being. Also a section on spiritual beliefs and practices, and the last two I find especially interesting: the importance of being of service to others and having a sense of meaning and purpose in life. That there's a strong connection between your overall well-being and these practices in your life of being involved and feeling like you have a reason to be and to be helpful to others.
Next slide, please.
So the role of the peer in WHAM, there's the importance of your personal story, and people that go through the training for WHAM are people who have both mental health or behavioral health diagnosis as well as a physical health diagnosis. And that way, that's part of the way you can relate your lived experience to the person you're helping. There's also person-centered planning, which includes making a very person-centered goal. And they use something called impact to make their goals. And impact stands for, does it improve, that's the I, the quality of my health and resiliency. So when you're talking about your goal, does it improve that? Is it measurable? Will I know when I've completed it? Is it positively stated as something new I want in my life? Versus saying, you know, I want to weigh less, 50 pounds less. It's, well, why? What would the positive outcome of that be for you? Is it achievable with my current situation and abilities? So looking at if there's a gap then between what you can do right now and this goal that you're interested in. Does it call forth actions that I can take on a regular basis? So a goal that includes very much an action plan. And then is it time limited? So the goal is not open-ended but really has a focus and timeline so that you can be successful and achieve it. Also, there are structured individual or educational sessions, and that's what you can see in the manual. And peer support happens in a group, but it also happens one-on-one. Next slide, please. Now we have the Health and Recovery Peer Program, which is HARP. And HARP is also doing some great work. They've based their program on something called Stanford's Chronic Disease Self-Management Program, which has had very successful outcomes for the general population. And so they made some modifications to work with substance abuse and mental health in primary care settings. So this is 6 2.5-hour sessions of classroom-based groups. And it includes an overview of self-management. What does it mean to handle these issues yourself? Exercise and physical activities, pain and fatigue management, healthy eating on a limited budget, medication management, and then finding and working with a primary care doctor. So that's a lot about how do you access the support that you need. All right, next slide, please. The strategies used in HARP, we went over that it's based on Stanford's program. Let's see. It's pairing group members to work together so that they can get the action plans written and goals written. It's to increase motivation and engagement for the person coming in. It includes a self-management record, so there's a lot of tracking of medications, tracking of appointments, dietary intake, physical activity. And in the group, people are taught how to make some short-term action plans so that they identify a problem that they're concerned about. They get some support listing ideas for solving the problem, and also in the group, they develop a specific plan to achieve it. And next slide. So the peers teach the instructional material. They're the people doing the classes. They model appropriate behaviors and responses. That's part of the process. And they really work to engage everybody in the group, so to ensure participation. And their intention is to help increase motivation for everybody in the group. And our next slide has to do with what's called the 4 core functions of peer support. So this is kind of the summary. Across all the programs and all the positions that we're going to talk about next, there are some basic functions. And what I'd like you to do is to be thinking about what you already know about these 4 core functions, because even though these are being used in integrated healthcare settings, they will, I'm sure, sound very familiar to you in your work as peer supporters in all settings. So the first one is assistance in daily management of health issues. So peer supporters use their own experience to help others to figure out how to manage the health in their own daily lives. Peers are very important in identifying key resources, and also usually in my experience are a wealth of information on resources and ways to live on a budget and convenient places to go exercise. They kind of know a lot about the community. Then there's the social and emotional support that peers offer. And empathic listening, being a voice of encouragement. Peer supporters really help people cope with kinds of social or emotional barriers that they might have, and how to stay motivated. I think all of us can use the help of someone that's there to help us when we're feeling like we can't really do it anymore. And so that's the role of peer support too. And we've got two more.
Next slide.
Peer supporters especially bridge the gap between patients, consumers, and health professionals. So this you might be already doing in your positions in mental health, is linking people to resources and helping with maybe what's called a warm handoff, helping people connect to the services that they need. And finally, ongoing support, which is extended over time. So it's not a one-shot deal for the most part. That peer support functions as being a relationship over time. And it's how you can be proactive, how you can be flexible, and really do some long-term follow-up with people so that they can maintain the new behaviors. Next slide, please. So one thing that we wanted to do in this next poll, our final poll for today, is to think about the core function that you have the most experience with. So when you're thinking of a possible position in integrated healthcare settings, which of these four functions do you feel pretty strong at? And we'd like you in this next poll to identify the one that you feel is a real positive strength for you.
I'm going to go ahead and close the poll. And we had everyone selecting at 100% ongoing support extended over time.
Ah,
very interesting, wonderful. Yeah, I mean, that's a statement to the relationships that are built as peer supporters. And I think that is one of the very powerful ways that peer support helps, is you're there with people over a lot of time. So thank you for doing that. Let's go to the next series, which is about common job titles and duties. This is to help you in looking for work in this integrated healthcare field to kind of understand what the different terms mean. Now, my caveat on this is it's a new field, and sometimes the job titles don't have the same job duties attached to them, so definitely make sure you read the interpretation of the job that you're applying for. But these overall represent the definitions of some common job titles and duties that you might see. So the first is peer whole health coach or wellness coach. This involves having a lived experience of behavioral health challenges as well as a health condition. That's usually a prerequisite for the position. And then your role is to assist people to identify and pursue a change they'd like to make in the area of wellness, and assisting in the development of a health goal. And it's also done in an individualized, very person-centered service plan, and then providing support to achieve that goal. and that support can be given either individually or in groups. We have a health coach role in San Mateo County, and the peer support or the wellness coaches there are doing a lot of wonderful groups in addition to having one-on-ones with people. Next one, please. The next one is a role called the promotora, and there are several places that have these jobs available, and this is an individual who shares cultural and linguistic qualities with the Hispanic and Latino community. So they're serving as a cultural bridge between the community-based organizations and their, the Latino community. A lot of focus is on increasing enrollment in health insurance programs and then increasing access to preventative care. But it also helps to establish what they call a usual source of care, which means a relationship with a primary care doctor, and really improving people's self-efficacy, their ability to manage the healthcare system and get what they need. Next one, please. So then we have the peer health navigator. And this is someone who provides information and education, so there's some educational aspect to it, outreach and engagement, referring and linkage activities. It may also include an active, warm handoff to the primary care health services. This means literally sometimes walking the person over to the place where their primary health care services will be delivered. And it also is oftentimes assisting the client to advocate for themselves so that they can get their needs met. Okay, next one. Then we have a peer health educator. This is someone whose focus is really health and wellness classes and groups. And there's some wonderful material out there for smoking cessation, for weight loss, manuals that you can get training in and then be a peer health educator in those particular health issues. And you might also already be doing things like walking groups. And when you connect giving education and specific health issues, that's what a peer health educator would be doing. Next slide, please. So then we have, to wrap up, the main goals of peer support and integrated care across all these job titles, across the different programs. And so if we wanted to summarize what you would be involved in as a peer in a integrated healthcare role, the first is engagement. The first is that you're in the process of creating a real partnership in order to take the first steps in dealing with health-related issues. So as a peer, without engagement with a person, all those negative health outcomes just continue to be a high risk. So very first order of business is engaging someone. Next one, please. The second main goal is then activation. So once you've created a relationship, you start where the person's at, and then you help the individual increase their motivation and their involvement in building health and wellness routines into their lives. Let's go to the next slide. Here you'll see an interesting chart that they've developed that shows levels of activation. So in level 1, you're working with somebody who does not feel very confident to play an active role in their own health, and they might be fairly passive to begin with. They're just not used to taking charge. That moves to maybe still lacking some confidence, but you're adding knowledge and confidence building in there, moving them up the level of activation. By level 3, the individual is taking some action. They have information, they're starting to build their confidence and have some support around them to do it. And the final level of activation is when people are maintaining their positive, healthy behaviors. So they've gotten support in doing what they need to do to be healthy and well, and are staying on that program. Next, please. So the final main goal is in self-management. So we go from engagement to activation to self-management. This is when you're taking charge of what otherwise you might feel is very overwhelming or disempowering. And many times chronic conditions, pain, things like diabetes and heart disease, they can be very overwhelming. So self-management means that you are able to take some steps to feel better, to reduce your risk factors, to increase your health. And it really reduces the impact of having a big health issue. Next, please. So in your role as a peer in self-management is to give information and teach specific skills related to whatever health ailment the person's dealing with. You're also negotiating health behavior change in a collaborative way with consumers. You know, we can't just say no, or you have to exercise. It's finding out where the person wants to start and negotiating some behavior change that will lead to hopefully more and more positive behavior change. And finally, you're also providing training in problem-solving skills. Let's go, we're at the next slide here, so that's fine. You want to assist with the emotional impact of having a chronic illness. Any of you that might be dealing with that yourself or have loved ones that are dealing with a chronic illness, you know there's a toll that it takes emotionally, and so peers are very helpful in providing support. Peers also provide regular and long-term extended follow-up and actively encourage participation in managing illnesses. All right, let's go to the next slide. So the last thing we want to talk about before we open it up for some questions here is understanding workplace culture. Now, all of you are probably familiar with and have probably come up against some values and differences from what it means to be a peer and how peers operate from a peer values and ethics standpoint, and how traditional settings operate. And that can definitely be a bit of a clash. So peer values of mutuality and relationship, you know, we're both equal. In the traditional settings, there's much more of a professional-client relationship. And I would say in primary care, it's probably even more pronounced. Peer values are non-hierarchical decision-making. Traditional settings are very hierarchical. That's kind of how they operate. Peer values are around that peers give each other feedback and even give feedback to your supervisor, that mutuality and supervision. In traditional settings, it's only really the supervisor that gives feedback to the supervisee. Peers do a high degree of self-disclosure. Traditional setting and traditional professionals do not. Peers are very focused on personal wellness tools as part of their work ethic. And unfortunately, in behavioral health and primary care settings, there's often very minimal attention given to personal wellness on the job. Next, please. So what we want to point this out, because part of what you're doing in going into these positions in your new role, it's that it is a new role in a lot of these settings. And so you're going to be noticing some differences in the culture. And you can be part of the change that helps these different settings where your work is so important to be able to combine the best of what you have to offer with the best of what they have to offer. So we want to create a workforce that's aware and knowledgeable about the worldviews of physical health, mental health, and substance abuse, the three cultures that constitute integrated care. We want to have knowledge of recovery culture, and especially as it relates to client culture. And you would be part of bringing that into these systems. And then we also want to have a culture of inclusion that understands what peer support is and how to best use peers so that they really bring all their skills and talents to this issue that we really care about, which is improving the life expectancy and quality of life for people who have mental health challenges. So it's a big job. You'll be pioneers in this, and many of you were probably pioneers already to begin with in mental health. So it's an opportunity to pioneer once again. And we know that as this happens more and more, we're going to see those negative health outcomes change, and that's what's going to really make it worthwhile. I can't wait to see those new outcomes expand in more places and people have a better quality of life, better health outcomes because of the work that you can do as peers. And with that, I think what we'll do is take a look and see if we have any questions.
We do have some questions that we can begin answering, but also Kelly will be accepting questions in the question box. So while we're answering the ones that we already have, she'll also be looking for those. So the first question is, are integrated healthcare jobs only in primary care doctor's offices, or can I work in a behavioral health clinic and do integrated care?
Yes, actually it's done differently, so both things are possible. For example, in San Mateo, integrated care happens at the behavioral health clinic, and they've hired nursing staff, and the primary care staff are located at the behavioral health office, but they're doing integrated care there. So it just depends on how your county organizes it. But thank you for the question. That's a good one.
Yeah. If I'm a peer, what are the best ways for me to develop my skills so I can be employed in integrated healthcare settings? That's a really good question. There are a couple of training programs. Pacific Clinics in Los Angeles has a whole institute on training peer navigators. I believe it's Sonoma. Is it Sonoma State or Solano? I mean,
Sonoma,
State.
I think.
It's Sonoma. It's Sonoma State.
Yeah, has a healthcare navigator program at the college. WAM has a training program as well. They come out from Washington, D.C., I think. So you can actually look WAM up at the SAMHSA. So it would be SAMHSA, HRSA, HRSA.org, and they have a whole integrated care peer support model called WAM, and you can get training that way. Now, I would say none of these things are inexpensive, and so if you're with an organization, they would most likely invest in getting many people trained at one time.
I have one other suggestion, which is sometimes there are offerings in smoking cessation classes, in weight management classes, that you can learn how to run some of those groups. And they tend to be, they're often available also through county-sponsored trainings, but that can be another source of expertise that you can develop, is start getting some health education subjects that you can be familiar with and able to run groups in.
And HARP is still developing their program. I think they're in New York, and they're still, I'm not sure if there's any training specific to HARP, although they do have a lot of materials online that you can access. The other thing that on the next slide, but we'll talk about it now, is we've actually written a toolkit, which I mentioned this earlier, that you can access if you go to casra.org. You can actually access the toolkit that talks about meaningful roles for peer providers in integrated healthcare settings. And that can give you some more information about training locations. Who tends to hire the most peer specialists in integrated care? Well, I think this is so new that it would be very hard to answer who hires the most. Right now, my guess would be in California, it's specific clinics because they have a major program doing this. But you're going to see more and more behavioral health programs hiring peers, I think. Probably most integration in specialty mental health is going to occur in the behavioral health care site. And so that would be probably the primary location to look for peer support or health coach jobs. And how are family partners used in providing integrated care? Which is another good question. Oftentimes, family partners are working with the family members and the children. So I don't have examples of how it's currently actually working, but I can see the definite benefit of having family partners working with family members who haven't been able to access care for themselves and who may be under quite a bit of caregiver burden and prone to many healthcare issues. Also, I can see family partners in the role of assisting the adults to access better care for children. So, for example, children with ADHD need a lot of specialty care beyond behavioral health, but also from primary care physicians and counselors. So I think there's definitely a role for family partners in helping families get access for themselves, but also for their children. And let's see. So do we have any other questions, Kelly?
There are no other questions at this time. I think you guys covered them all. And we just want to remind everyone that our next PLI webinar is on April 14th, 2016, and it's entitled Engaging Families. And then I think you guys have one more slide.
Oh yeah, this is just a resource if you want to download the, it's really a toolkit. In it offers actual job descriptions. It gives some more models in California around who's providing this kind of service. This service exists in behavioral health care settings, but it also exists in nonprofits, agencies, as well as peer-run nonprofit agencies. For example, Manzanita Services in Mendocino County. So there are all kinds of resources in that toolkit, not only for peers, but for supervisors and administrators. So if it's something that you want your organization to start looking at, you can direct administration to the toolkit as well. And that's a free resource for download on the CASRA website.
All right. Well, any other questions? Any last minute pieces? If not, we want to thank Deb and Lucinda for a wonderful presentation. And just a reminder, the next webinar is our next webinar on peer support and working with families. We'll have Andy Kim speak to us from the FERC project in Oakland. And I believe that's all for today, and we thank you very much.
Thank you.
Thanks, everybody.
Thank you.